Hello and welcome. Today we're diving into the complexities of autoimmune hearing loss, a condition where the body's own defense system mistakenly attacks the delicate structures of the inner ear, leading to hearing impairment. Join us as we explore its causes, symptoms, diagnosis, and the latest advancements in treatment. The exact cause of autoimmune hearing loss remains somewhat of a mystery. It is thought to arise when the immune system, which normally protects the body from foreign invaders, misidentifies cells within the inner ear as threats. This can be triggered by a variety of factors, including genetic predisposition, prior viral infections, or exposure to certain toxins. In some cases, it may occur alongside other autoimmune disorders such as lupus, rheumatoid arthritis, or Cogan's syndrome. When the immune system targets the inner ear, it unleashes a cascade of inflammatory responses. Immune cells, like T cells and B cells, infiltrate the cochlea, the part of the inner ear responsible for hearing. They release antibodies and cytokines that damage the hair cells, the sensory receptors responsible for converting sound vibrations into electrical signals that the brain can interpret. This damage disrupts the normal hearing process, leading to hearing loss and potentially other symptoms like tinnitus and vertigo. Autoimmune hearing loss is a relatively rare condition, making it challenging to pinpoint precise epidemiological data. It's estimated to account for less than 1% of all cases of hearing loss. It can affect individuals of any age, but it's more commonly diagnosed in adults, particularly those between the ages of 20 and 50. There doesn't appear to be a significant difference in prevalence between men and women, and it affects all ethnicities. The signs and symptoms of autoimmune hearing loss can vary from person to person, but certain patterns are common. Sudden or rapidly progressive hearing loss is a hallmark of the condition. This hearing loss often affects both ears, though it can start in one ear and then spread to the other. Individuals may also experience tinnitus, a ringing, buzzing, or hissing sound in the ears. Vertigo, a sensation of dizziness or spinning, is another possible symptom. In some cases, individuals may experience a feeling of fullness or pressure in the ears. Diagnosing autoimmune hearing loss can be challenging, as its symptoms overlap with other hearing disorders. A comprehensive hearing evaluation, including audiometry, is crucial. This helps determine the type and severity of hearing loss. Blood tests are typically performed to look for signs of inflammation and autoimmune activity. These tests may include erythrocyte sedimentation rate (ESR), C-reactive protein (SRP), and tests for specific autoantibodies. An MRI of the inner ear may also be conducted to rule out other causes of hearing loss, such as tumors or structural abnormalities. Response to steroid treatment can also be a diagnostic clue. If hearing improves with steroids, it strengthens the suspicion of autoimmune involvement. While there isn't a universally accepted classification system, autoimmune hearing loss is generally categorized based on its association with other autoimmune disorders. It can be classified as primary or secondary. Primary autoimmune hearing loss occurs as an isolated condition without any other identifiable autoimmune disease. Secondary autoimmune hearing loss occurs in conjunction with another autoimmune disorder, such as lupus or rheumatoid arthritis. Cogan's syndrome, a rare autoimmune disorder affecting the eyes and inner ear, is a specific example of secondary autoimmune hearing loss. The primary goal of treatment for autoimmune hearing loss is to suppress the immune system and reduce inflammation in the inner ear. Corticosteroids, such as prednisone, are the most common first-line treatment. These medications can effectively reduce inflammation and improve hearing in many cases. If corticosteroids are ineffective or cause unacceptable side effects, other immunosuppressant medications, such as methotrexate or cyclophosphamide, may be considered. In cases where hearing loss is permanent, hearing aids or cochlear implants can help improve hearing and communication. Supportive therapies, such as tinnitus retraining therapy and vestibular rehabilitation, may also be beneficial. Currently, there are no definitive ways to prevent autoimmune hearing loss. Because the exact causes are not fully understood, preventative measures are limited. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding exposure to toxins, may help support overall immune system function. If you have a known autoimmune disorder, working closely with your healthcare team to manage the condition may help reduce the risk of developing autoimmune hearing loss. Early recognition and prompt treatment of hearing loss are crucial to minimize the long-term impact of the condition. The prognosis for autoimmune hearing loss varies depending on several factors, including the severity of hearing loss, the promptness of diagnosis and treatment, and the individual's response to therapy. Some individuals experience significant improvement in hearing with treatment, while others may have persistent hearing loss despite treatment. early diagnosis and aggressive treatment are essential to maximize the chances of a favorable outcome. Recent research is focused on identifying specific autoantigens in the inner ear and developing targeted therapies to selectively suppress the immune response. Biologic therapies, such as TF-alpha inhibitors, are being investigated as potential treatments for autoimmune hearing loss. Gene therapy and stem cell therapy are also being explored as future therapeutic options to regenerate damaged hair cells and restore hearing.